This video demonstrates how to use the Avanos Introducer Kit for Gastrostomy Feeding Tubes, or IPK, which includes a telescoping dilator with peel-away sheath. The telescoping dilator with peel-away sheath allows for desired dilation with a single telescoping device, which reduces the need for repeated passing over the guide wire. The Avanos Introducer Kit for Gastrostomy Feeding Tubes is intended to facilitate stoma tract dilation prior to placement of the Avanos MIC and Mickey brand Enteral feeding tubes. Prior to dilation, ensure the stomach is in apposition to the anterior abdominal wall. See the IFU for full instructions related to preparing the patient and stoma tract to be ready to use the dilator. Select the appropriate dilation size based on the intended French size of the gastrostomy feeding tube being placed. Use the number 11 safety scalpel blade to create an appropriate skin incision that extends alongside the guide wire downward through the subcutaneous tissue and the fascia of the abdominal musculature. After the incision is made, lock the scalpel cover in place and discard the scalpel according to facility protocol. Verify that the skin incision is adequate to accommodate the peel-away sheath. Caution: excess lubricant may cause difficulty in gripping the dilator segments. Apply water-soluble lubricant to the stoma site. Advance the dilator top over the pre-positioned guide wire, through the tissue, and into the stomach using a clockwise, counterclockwise twisting motion while advancing to create a tract into the gastric lumen. Fluoroscopically verify placement of the dilator tip into the stomach. While holding the serial dilator stationary, grasp the next dilator sleeve and with firm pressure and a clockwise, counterclockwise twisting motion, advance the subsequent dilator into the stoma tract. Slide the segment forward until a physical stop is felt. Advance the red color-coded second sleeve with firm pressure and a slight clockwise counterclockwise twisting motion through the stoma tract and into the stomach. Remove the dilator from the stoma and measure the stoma length with the stoma measuring device. See the IFU for details on how to measure the stoma length. After measuring, remove the stoma measuring device and resume dilation by advancing the dilator over the guide wire, through the stoma tract and into the stomach, using firm pressure and a clockwise-counterclockwise twisting motion. Continue dilation until all dilator sleeves have been advanced. Twist the dilator hub to release the peel-away sheath from the dilator. Lubricate the exterior of the peel-away sheath with water-soluble lubricant and advance the sheath through the tract and into the stomach. Remove the dilator and guide wire, leaving the peel-away sheath in the stomach, with the remainder securely maintaining position in the tract and exiting the stoma site. Select the appropriate Avanos MIC or Mickey enteral feeding tube while maintaining stomach and stoma tract access via the pre-positioned peel-away sheath. Peel the sheath down to skin level. Inspect and prepare the gastrostomy tube according to the selected gastrostomy tube instructions for use. Advance the tube down the peel-away sheath and into the stomach. After the tube has been advanced through the peel-away sheath and is in position in the stomach, peel the sheath away from the tube and remove and dispose of the sheath according to facility protocol. Complete the procedure according to the Avanos MIC and Mickey brand enteral feeding tube instructions for use.